Today, the United States has tested its very first coronavirus vaccine.
In Washington state today, U.S. researchers tested the first experimental coronavirus vaccines.
In Seattle today, the first patients were given shots in a clinical trial of a potential vaccine for COVID-19. About 24 potential vaccines are being developed around the world.
Steve?
Can we get Dr. Fauci to talk about the vaccine trial today and whether the timetable for a vaccine is it possible to accelerate or is it still 12 to 18 months?
So, thank you for that question. The vaccine candidate that was given the first injections for the first person took place today. You might recall when we first started, I said it would be 2 to 3 months, and if we did that, that would be the fastest we've ever gone from obtaining the sequence to being able to do a phase 1 trial. This has been now 65 days, which I believe is the record. What it is, it's a trial of 45 normal individuals between the ages of 18 and 55. The trial is taking place in Seattle. There will be 2 injections, one at 0 day, first one, then 28 days. There will be 3 separate doses, 25 milligrams, 100 milligrams, 250 milligrams, and the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protective. And that's exactly what I've been telling this group over and over again. So it's happened. The first injection was today.
Sir, the market just closed down 3,000, almost 13%. Your response to the market close, sir?
Is pregnancy an underlying condition?
Thank you. Dr. Fauci, is there guidance for someone who may have felt sick but then feels better, so you had symptoms but you no longer do, your fever's gone away? How long would you stay home after that point? That's not clear from the guidelines.
Well, if you are positive for the infection, if you have coronavirus, it is less how you feel than whether or not you're still shedding virus. So the general issue about letting people out of a facility, who, for example, a hospital or whatever, who have been infected, you need 2 negative cultures, the same way that was just described, 24 hours apart.
In Washington state today, U.S. researchers tested the first experimental coronavirus vaccine, starting off with a worldwide hunt for protection, even as the pandemic continues to grow. I want to bring in Dr. John Brownstein now, Chief Innovation Officer at Boston's Children's Hospital. Dr. Brownstein, thanks so much for joining us.
Of course.
So the group tested today has 4 healthy volunteers who will be monitored over a period of time. Can you explain what this process will look like and how those people will be tracked?
Right. So we're at the early phases of this vaccine trial, right? So phase 1, meaning small group of people are going to be evaluating for how they react, how well they do, if potentially there's some efficacy, also some early information about safety. But we have to remember, this is a really small trial that it will eventually lead to more participants, but we're still so early in evaluating this vaccine. It's incredibly exciting. Vaccines are a big backbone of public health, and we should be striving. But again, we're still many months out from having something that we can really deploy to the public.
It's still incredibly early. I hear you saying many months out, but if these tests prove to be successful, how soon could the country expect a rollout of the vaccine?
So the vaccine that we're looking at is an incredibly modern type of vaccine. It's based on RNA. It's not the traditional way of building a vaccine, so we're going as fast as humanly possible. But the problem is that we're still, with phase 2 and 3, we're still going to have to test the efficacy, but also the safety. It's so important that we get this vaccine right. And so that's going to lead us to probably a year to 18 months before we can really have this vaccine well past, especially the first wave of this epidemic as it's unfolding across the country.
And we know that states are now taking testing into their own hands. Is there a benefit to spreading out the resources, or should there just be one overarching test?
No, I mean, I think the reality is we need all hands on deck on testing. Of course, there's the commercial labs, there's hospitals. Many people are now deploying tests. We need to have a direct understanding of what's happening in communities across the country so that we can really deploy the resources properly. So, I think the idea is to have as diverse number of groups sort of working towards this as possible.
And last question for you, as people start to work from home and continue to wash their hands, what else can people do to try to flatten the curve?
Right. So the idea is all about social distancing, right? So limiting your grouping with other people, staying at home. Of course, we're going to depend on those that are recovering, right? So those that actually had the virus and recovered, they can play an incredible role in actually being active members of society as other people are quarantined inside. So we'll have to remember those recovered as well. I mean, at the end of the day, we're trying to protect our health systems from getting completely overrun so we can take care of the sickest patients.
In Seattle today, the first patients were given shots in a clinical trial of a potential vaccine for COVID-19. About 24 potential vaccines are being developed around the world, including one at the National Institutes of Health and another at the Walter Reed Army Institute of Research. That's just outside of Washington. David Martin went there to show us how it works.
This is the part of the coronavirus that can actually infect you.
This is the part up here that latches on to your lung cells.
Dr. Kayvon Majerad is a director at the Walter Reed Army Institute of Research.
This is obviously magnified. What is the actual size of this?
About 20,000 of these could fit on the head of a pin.
He's testing a potential vaccine that would block the virus from attaching itself to your lung.
If it can't get into your lung cells, it can't cause the disease.
The race for a coronavirus vaccine will take 12 to 18 months to run. So Lieutenant Colonel Mara Kretschmann-Dietrich is working on a drug that people who already have the disease can take.
What we're aiming to develop here is an antiviral treatment that will kill the virus and actually cure them of the disease so that they don't further spread it to the rest of the community.
She says an existing drug used against Ebola may work against the coronavirus as well.
It's ready for clinical trials in humans, and once those clinical trials show that it's effective, then it will be available for wider use in humans, yes.
It hasn't yet been proved effective, but could be used as an emergency treatment. David Martin, CBS News, Walter Reed Army Institute of Research.
Today, the United States has tested its very first coronavirus vaccine. It went to a volunteer that you see right here, 43-year-old Jennifer Haller, who is from Seattle. That's one of the hardest hit areas for this virus in the nation, Washington State, with over 840 cases. It's a fast-moving story, and she joins us right now, the very first coronavirus vaccine volunteer, Jennifer Haller, and back with us for a medical perspective, Anne Rimion, an epidemiologist at UCLA. Jennifer, thank you for what you're doing. Obviously, this fits into a lot of the different ways people are participating and trying to help around the nation. And thank you for being willing to talk with us.
Yeah, I'm so happy to be here. And I'm so excited to be the first person. This is crazy.
Yeah, right. Crazy is one word for it. I think it's got to have a lot of different feelings for you. Very straightforward. I'd love for you to just tell us, as they say in your own words, how did this come about, and walk us through what happened today.
Yeah, just a couple of weeks ago, there was a call for volunteers, and filled out a form and got a call back, and went through the phone screen, past that, went in person for a physical exam, blood draw. Everything looked good there, and here we are. I went in this morning at 8 a.m. and got the first dose. There it is. I am. We feel, all of us, I know we feel so helpless, like what can we do? And I am so excited that there was actually something that I could do, and I did it, and I'm doing it. And I'm so proud of myself, and so thankful for the privilege that I have that allows me to do this. I'm healthy. I have a full-time job, salaried job. My company is flexible. They allow me to take time off to do this. I've supported friends and family. My real concern is for the people that have hourly jobs, that lives are going to be severely impacted coming up soon.
Based on what you're learning and what you're participating in, where does this process go from here?
I do a daily log, temperature and any side effects that I'm feeling. I keep track of those. I, of course, call in if I have any issues. Do a phone call tomorrow, phone call the next day. I'll do weekly follow-ups, and then I'll get a second dose of the vaccine in, I think, about 4 weeks. And then I'll be followed through about 14 months through the study.
And did the folks involved in this tell you about any potential risks? Obviously, this is, to put it simply, hopefully a good thing, and you're participating in it. But you can imagine some people at home wondering, oh, my gosh, everyone's nervous about all sorts of things right now. How were you walked through the risk? How do you see that?
Yeah, a really important thing to understand that's really helped a lot of friends and family who were concerned is that this this vaccine uses messenger RNA, so it does not use any of the virus. So at no point during this study will you be exposed to the virus. So that's awesome. Regular potential side effects from a vaccine. Totally up for those. And then, of course, there's the absolute unknown, right? This one has never been tested in a human, and I'm up for it. I'm ready.
And if they do have a breakthrough here, would you be really excited to be a part of demonstrating that? I mean, there's so much of this story that's been so hard on people. It would seem this would be an opportunity potentially. I don't want to get ahead of obviously the test run, but would you be excited if it works out?
Well, I mean, of course, yeah. I mean, the chance that I could have something to do with helping save lives is huge. And if this isn't the right vaccine or whatever, I mean, at least I'm part of the process. We're part of figuring this out and getting closer to something to help everybody.
Yeah. Fantastic. Stay with me. As mentioned, we're getting this very newsworthy perspective from you as Americans and people around the country and the world are wondering about the race for a cure or a vaccine. As mentioned, I have Dr. Ramoyne here. What do you think it's important that people understand about these types of tests?
So in terms of the vaccine that we're discussing right now, vaccines will take a while to be able to move forward and to be able to go through all the safety testing. There are a lot of regulatory aspects here, and what this woman is doing right now, which is really wonderful, is participating in a vaccine trial. In terms of tests, there are several tests that are coming online, and the more that we can get screening going rapidly, disseminated everywhere, the better we are, and the more that we'll understand what we have in this country in terms of burden of infection. That will help dictate where policy goes.
And again, following up to you, everyone wants to know about timelines. How quickly do you think we could learn about whether a given vaccine or a given experimental cure could be workable and then distributed?
It really, there are several steps, regulatory steps that have to happen, and this is to protect people, to make sure that there are no side effects, that the safety data is really straight, is very good. And once we have those data, then it can move forward into the next step. But there are always several regulatory steps that protect everyone, so that when a vaccine is available to the public, it will we'll know that it works well. And we still do believe that this will take at least a year or so to be able to be available to the public. So right now, all of the measures that we're talking about, we can't be putting our hopes into a vaccine. We need to be putting our energy into social distancing, to making sure that hospitals are not overloaded, and that everybody does their part to be able to slow the spread of this virus.
Really great points about the difference between a panacea or hoping for this to all just be worked out versus all the things we've been covering that people still have to do. Jennifer, final question. What do your friends and family say? What are you telling them?
Some are wary about it, but no, it is amazing the outpouring of support and love that I've received from friends and family, and I've had messages from strangers on Facebook thanking me, and it's so. I'm just so thankful that I get to be part of this.
Fantastic. I think it's great what you're doing. I appreciate you not only doing it, but taking time to share something that is, for some people, would obviously be private or difficult. You're clearly a person that's willing to jump in and also be a part of sharing what could be the search for some scientific breakthroughs here. Jennifer Haller, thank you.